Hi, I'm Sam. I'm the COO of LiquidGoldConcept. Today, I'm going to walk you through our breast health training tool. The LiquidGoldConcept Breast Health Training Tool, or BHTT collection, is a must-have educational resource for all healthcare professionals. With these 10 breasts, students can practice identifying, describing, and managing over 50 common lactation-related and breast health conditions across the lifespan. This BHTT curriculum preview is just the beginning of our comprehensive problem-based learning breast health course. In this video, I'll share a few examples of case scenarios and guiding questions for each breast. An exclusively pumping patient comes into your urgent care clinic because she saw that she was pumping bloody milk. To help your learners think through this case, have them establish a broad differential diagnosis. What if upon exam you saw a drop of blood from one nipple pore? What about from multiple nipple pores? And what if instead of a drop of blood, you saw a blood blister on the nipple tip? In the emergency room, you see a breastfeeding patient who developed a painful rash 2 days ago. Have your students describe the rash and discuss with them whether or not this mother should stop breastfeeding her child. The rash on this 60-year-old woman's breast has not improved despite her attempts over the last 3 months to treat it with various oils, lotions, and steroid creams. What additional information about this woman's medical, family, and surgical history, as well as her medication use, is required to better understand the underlying etiology of this rash? Have your students practice a breast exam on the essential LSM and let them know that instead of the left nipple, they see breast 4. Breast 4 represents a sexually active 40-year-old woman with a history of illicit drug use who came into your clinic with a nipple ulcer that has gotten progressively worse over the last 2 weeks. Six months ago, this woman noticed brown discoloration on her nipple. Today, she visits your clinic after applying a topical steroid and noticing it did not improve her condition. Ask your students to pair up and discuss how to differentiate between the changes on the nipple areolar complex between Paget's disease of the nipple and an eczematous rash. This morning, a breastfeeding patient came to your ER presenting with deep, shooting breast pain. She and her infant were both treated for a yeast infection 2 weeks ago. Have learners discuss ways to distinguish a raised pigmented lesion from a benign mole, melanoma, an accessory nipple, or a cutaneous manifestation of underlying malignancy. After recently returning to work, this mother has added an extra pumping session on her way to work in the morning. Yesterday, she began to experience severe pain while pumping. She is worried that she will have to supplement with formula because pumping is now too painful. Ask your learners to practice correctly using a breast pump with the advanced LSM. This mother is concerned that her baby is continuing to lose weight. She's in tears because breastfeeding is incredibly painful. Practice demonstrating correct infant positioning and attachment on the essential lactation simulation model. Have learners discuss determinants of a shallow or deep latch. A 75-year-old woman presents to the emergency room with a diffuse rash after taking her friend's antibiotic medication. Her last mammogram was 15 years ago. Learners should practice obtaining a comprehensive medical history and describing and documenting the appearance of the nipple areolar complex and breast tissue. A breastfeeding patient presents to the lactation support group with severe breast engorgement at 3 months postpartum. Practice breast engorgement massage techniques on the essential LSM and describe the importance of distinguishing between an inverted and retracted nipple on this breast. We are now developing the full curriculum that will include multiple case scenarios per breast with specific learning objectives, an instructor manual, student worksheets, and assessments. We anticipate releasing this curriculum by the end of 2019. Subscribe to our newsletter or visit our website to receive updates.